Welcome back, and we'll be starting with the back and the suboccipital regions today. So the superficial extrinsic muscles are considered the extrinsic muscles, and they are involved with the pectoral girdle and the thoracic cage. So going forth, we're going to start with the trapezius. Here it is. It elevates, retracts, rotates, and depresses the scapula, and the latissimus dorsi, extends, adduct, and medially rotate the humerus. The levator scapula elevate and rotate the scapula, and the rhomboid major and minor retract, rotate the scapula, and it fixes the scapula to the vertebral column. So the intermediate extrinsic muscles are very thin. They're used as superficial respiratory muscles and play a larger role in proprioception. And the smaller roles that they do play is that the serratus posterior superior, as you can see, the fibers descend. They elevate the ribs when you inhale, and they contract. And the serratus posterior inferior will depress the ribs when they contract, used in exhalation. The intrinsic muscles are the deep muscles, and they play a large role in stabilizing the vertebral column. And they lie in the hollows on each side of the spinous processes, and they extend from the cranium to the sacrum. So each of the individual muscles causes one or several vertebra to be extended or rotated on the vertebra below. So if it inserts on this particular vertebra here, the next insertion would be like either one or two ribs below. And this is quite useful for us because the origins and insertions overlap, and the vertebral column can move smoothly. So the intrinsic or the deep muscles have several components. This is the superficial component, and it involves the splenius capitis, where it inserts into the superior nuchal line, and the mastoid process, and they originate from like the thoracic region 1 through 4. The splenius cervicis also have the similar origin from T1 and 4, and they insert into the transverse process of the upper cervical vertebra. And these play a role in tilting back the head when they contract. So deeper is the intermediate level, and they are all called the erectus spinae, and they all originate from the same area, which is the iliac crest, the sacrum, the sacroiliac ligament, and the spinous processes of the lumbar and the sacral region. So first, let's start with the most lateral. That would be the iliocostalis, and it goes across the transverse lumborum, the thoracis, and the cervicis, and it inserts into the lower ribs and the transverse processes of C4 through 6. Longissimus is medial, or the medium muscle, and it lies between the tubercles and the ankles of the spinous processes, and they attach to the transverse processes in the thoracic and the cervical region, and all the way up into the mastoid process. Finally, the most medial is the spinalis, which is only really in well-defined in the thoracic region, and it also extends a little bit into the cervicis region, and a bit of it will insert into the spinous processes in the upper thoracic and the cranium. So the semispinalis is the most superficial of the intrinsic deep transversospinalis muscles, and it spans about 4 to 6 vertebrae, as you can see here. So if this is the origin, it will insert like 4 vertebrae down. The multifidus is a deeper muscle, and that one will span, 2 to 4. So this is like kind of like a dissected image. This would be covering, the multifidus, and the multifidus would be covering these, the rotatories. These are the deepest. They span only, 1 to 2 segments, and they all play a role in being able to rotate the spine. So the multifidus is the deepest the thickest in the lumbar region, and the rotaris is best developed in the thoracic region. Going even deeper is the intrinsic deep muscles, and these are the interspinalis, which is right here, the intertransversory, which are right here, and the levatus costarum. So those lie in between the ribs, and they function more as organs of proprioception. The largest fascia that we have in the back is the thoracolumbar fascia, and it lies right here between the iliac crest and the 12th rib. Laterally, it gives origin to the middle fibers of the transversus and oblique muscles. So these triangles are very important. The auscultatory triangle is where us physicians place our stethoscope, because it is the point where there is the least amount of muscle and bone covering the lungs. So this will give you the clearest region of the lungs, and that is bound right here by the medial edge of the scapula, the inferior edge of the trapezius, and the superior edge of the latissimus dorsi. Another important triangle is the lumbar triangle, because that is where herniations occur. Here it's bounded by the iliac crest and the external oblique and the latissimus dorsi, and the floor of the triangle is the internal oblique. Let's go into the nerve supply. So there are 31 pairs of spinal nerves, and it innervates the body segmentally. Important notes is the posterior rami of the 1st, 6th, 7th, 8th cranial nerves, and the 4th and 5th lumbar nerves only supply the deep muscles. They don't supply the skin. Another note is the posterior ramus of cranial nerve 2, the optic nerve. It will ascend over the back of the head and supply the scalp. So these these spinal nerves will innervate the body in segments, like very clearly defined segments, and that's useful as for us clinicians, because if a patient comes in complaining, for example, of numbness in a band only at his nipples, and if you studied the dermatomes, you would know exactly which spinal nerve has been compressed or damaged. And looking over here, it would be T4, and we would know that that area of the spinal cord has been damaged. So let's go through the arteries. The head is supplied by the vertebral, the basilar, and the carotid arteries, and the thoracic is supplied by the aorta, the intercostals, of course, for the ribs, the anterior spinal, and the posterior branch. The lumbar is supplied by the lumbar segmental, the common iliac arteries, and the sacrum is supplied by the middle sacral, the iliolumbar, and the internal iliac. These are the veins. The jugular superior vena cava will drain the head, while the segmental and the inferior vena cava will drain the thoracic region. And in the lumbar, there is going to be the azygos, the hemiazygos, the lumbar segmental, the common iliac, and Batson's plexus to drain. So the veins in the spine have no valves. So it is problematic if infection happens to infiltrate, because then it would have free reign all the way up to the brain. Lymph drainage. So the deep lymph vessels will follow the veins and drain into the deep cervical, posterior, mediastinal, lateral aortic, and sacral nodes. The ones we need to know are like the deep cervical, the lateral aortic, and the sacral. So the suboccipital region is important to note because it contains the vertebral arteries and the suboccipital nerve right here. So this triangle is deep to the splenius and the semispinalis, and is bounded by the obliquus captus superior, the rectus captus major, and the obliquus captus inferior. The floor of the triangle is bounded by the posterior arch of the atlas and the posterior atlanto-occipital membrane. And since I did tell you that the semispinalis captus is cut, this does provide the roof of it. Important to note, the greater and lesser occipital nerve block. So if we measure the distance between the occipital protuberance and the mastoid, a third of the distance, if you block it right there, it would be the distal approach to blocking the greater occipital nerve. And if you go 3 centimeters down and about like 1.5 centimeters to the left, that would be the proximal approach. This is really used for the blocking and treating pain in the distribution of the occipital nerves, which is a condition called occipital neuralgia. So it's important to note the surface anatomy because in surgery you would need to refer to these lines. This would be the posterior midline. And then this is called the vertebral arch because it goes down the transverse processes. Next would be the paravertebral line. And then at the angle of the scapula, that would be the scapular line. That's it for now. Thank you for your attention and good luck studying.